Hello and welcome to Freeman Medical Clinic, otherwise known as the Downtown Doctor YouTube channel here in beautiful downtown Austin. I have a friend suffering from seasonal allergies. So today I'm going to show y'all how to best utilize your intranasal sprays. And we're in Texas, so it's apropos to say just pretend like you've got a couple of guns. I mean, it's not really apropos because you wouldn't put guns up your nose. But anyway, and I don't have any nasal spray. So I've got this beautiful, I've got some things. Pretend these are nasal sprays, okay? And intranasal steroids are super helpful for seasonal allergies. And you would only be using one nasal spray at a time, but you will always remember this because I still remember the rep in rural, the medical representative in rural Missouri in the Ozark Mountains when I was a practicing country doctor showing me these two things. I've never forgotten it, so y'all won't forget it either. So you hold your nasal steroid spray like so, like the little, this actually looks a whole lot like a nasal steroid spray bottle. Have your fingers here. It's going to be a little pump action. And the reason you're going to aim your nasal spray out to the outside of your nose is because that's where our circulation is. So there's tissue on the outside of our nose. There are blood vessels that will extravasate this medication well all throughout your sinus passages, all around your eyes, by the way, and this is why you don't need eye drops when you're suffering from allergies in your head and neck, because used correctly, your nasal steroid spray is going to help with ocular involvement as well. So you take the bottle, you point it towards the outside of your nose. That's number one. There are only two things to remember, okay? Outside, and alternate your hands, okay? So you alternate because if you do like they do in the movies and you spray like this, you're just going to naturally aim that bottle towards the inside of your nose, and on the inside we just have cartilage. There's no circulation to extravasate that medicine upwards and outwards where you really want it in your tissue so that you feel better. So alternate your hands. In your right hand, you're pointing at your left nares. In your left hand, you're pointing at your right nares. Yeah. Okay, actually, that was only one thing. Wow, is it Monday? And I am blonde. Hey, when you're blonde, you can make blonde jokes. Okay, so that's really one thing, is the alternating of the hands. The second thing, there are only two things to remember, okay? The second thing is point your nose to your toes, which rhymes. So you think I would have remembered it more quickly, but I did remember it, which is important. So point your nose to your toes. And the reason is that if we spray medicine like this and we're pointing our nose to our toes, what's going to happen? That medicine's going to really extravasate beautifully all through the tissues here, involving the oculars, all the things up in here. So nose to toes and alternate your hands. Those are the only two things you need to remember. Now, if you're still listening, I'm imagining that you might really suffer from allergies, and let me feel free to put down my demos and give you some more pearls about allergies, okay? Seasonal allergies, what's happening? Your body is under attack from things on the outside, be it pollen from trees, from plants, whatever you're allergic to, mold, or whatever you're allergic to. I'm talking about the plant kingdom right now. I'm not talking about allergy to bee stings or allergy to shellfish or foods, but your outside environmental allergies, which really can be awful. What's happening is your body's under attack, and it starts this battle or war, and what it does is it puts out a bunch of inflammatory cells. they're little warriors. They really they think they're helping, and a little bit these inflammatory cells do help. But what happens, and the reason you feel really awful, is that you get too much inflammation built up in your system. So things have just gotten a little hyperly driven, and I don't know this. I have no factual basis for it, but it may be that evolutionarily we have not co-evolved well with a lot of plants and trees. You know how, are you into co-evolution? Oh my gosh, like a certain snake will co-evolve with a certain type of plant, and the plant will protect the snake, and the snake somehow protects the plant. This co-evolution is amazing. It's like a great relationship with another human being if you can co-evolve together, right? Lift each other up, help each other, protect each other. It's really beautiful. Yeah, that has not happened with so much with the plants, with many of the plants and trees and humans. So I don't know though. I don't know. 500 years ago, 5,000 years ago, maybe Homo sapiens and whatever was before us also suffered from allergies. Maybe. I don't know. Was it ever written on a hieroglyphic? If anybody has any information on this, let me know. Very interested in coevolution and mildly interested in what your opinions might be on the subject. More interested if there's any evidence or facts. All right. What else can I tell you? Steroid shots, underutilized. I know, a lot of doctors out there very scared of steroids. Look, it's not a character defect. They just aren't experts in the area. There are some types of steroids that have a huge androgenic component that would not be appropriate to use for a seasonal steroid flare, but there are less androgenic steroids that can be used very safely, and we use the safe steroids in our clinic very commonly. And look, it's decreasing human pain and suffering. And if you've suffered from seasonal allergies, you know what I'm talking about. And if there's a lot of inflammation up in your head, like just picture a cartoon model of your brain with a bunch of inflammation in there and tissue swelling. It's going to affect your ability to think, so it's going to lead to foggy thinking. Your eyes might itch and be red and watery. Because your brain might be inflamed, people often, very often, complain of, they're not really complaining, are they? They're just reporting to their doctor that they're tired, okay? They're reporting fatigue and being tired. Yeah, that's because your body's overrun, not only with inflammation, but also histamines. So histamines are these little things that get triggered in the body to release along with other cells of inflammation that can make you feel really poorly. And I would argue that it's your head and neck is what you feel and what you experience for most people when your body is under attack by allergies. But what's happening in the organs? What's happening in the organs that we can't see? What's happening to your kidneys, your liver, your pancreas? Okay? I'm just saying, I have no evidence for this, but it makes sense, doesn't it? That your body is probably being attacked, I mean, by the pollen, but also by itself with these cells of inflammation with the antihistamine or with the histamines. This is why antihistamines help for allergies, because your body is releasing histamines. So antihistamines are going to decrease that histaminic response. So if you want to really go full bore, if you're having seasonal allergies, first of all, get the diagnosis right. Feel free to consult WebMD, but then why don't you go to a doctor who actually went to medical school after undergraduate college for, 8 years or something training. Look, we don't know everything and we fail at a lot of things, but most doctors are pretty good at treating seasonal allergies, I would imagine, family doctors anyway. Allergists, even better. And it was an allergist who really taught me to not fear the steroid, taught me a lot about that there are different steroids. So this is not, to be fair, I don't think it's something I really learned. I don't remember exactly what we learned about steroids and allergies in med school residency, but I do remember, shout out to Dr. Edward Peters, allergist here in Austin, Texas. Okay, so if your allergies need more than the occasional steroid shot, more than the nasal steroids, combined with some antihistamines, then I do recommend seeing an allergist. So my allergies were beyond the things that I'm describing today, and I went to see Dr. Peters. He's an allergist here in Austin, Texas, who did the scratch test on my back. Okay, I've been working out, by the way. I've been lifting weights, and I'm stronger than I was before, which feels better out in the world. If you're not doing weight training yet, think about it, and especially if you're over 40. All right, so when you go to the allergist, if you're allergic to enough things and allergic enough, you may be an appropriate candidate for doing allergy shots or allergy drops. And these things work much like an immunization. They're homeopathic. So what these really smart pharmacists will take a drop of each thing you're allergic to, and depending on how allergic you are, they'll dilute that one drop of the thing. It's like the pure ingredient of the thing that you're allergic to, let's say oak pollen, and then they'll dilute it a whole bunch of times and make a year's worth of vials of these super diluted, way diluted of what you're allergic to. And then you go to your allergist. Depends on what y'all figure out. Sometimes it's twice a week, sometimes it's once a week. And listen, it's a commitment. I did these shots. I think we did my shots for probably 3 years, and it's been more than 10 years, and it's curative. I'm cured. Am I cured forever? I don't know. I've definitely had patients who after 10 years, maybe after 20 years, that immunity starts to wane. And if my immunity did wane and I needed them again, I would do those shots again in a heartbeat, because it's made my life so much more comfortable to not have these allergies. For example, I was allergic to every grass that they can test for in Texas. I just thought it was normal to run through a field of grass and then get very itchy and red and splotchy and super uncomfortable. And I'm a nature girl, so I like to be out there running amok in the grass and the muck, and laying out on my blanket in Barton Springs. Even laying out on a blanket at Barton Springs, I would get all itchy. Ugh. Yeah, so what else can I tell y'all about allergies? It is not a character defect. It is not related to poor hygiene in any way. It has nothing to do with your overall immune system. My mom doesn't watch my YouTube channel, so we're safe here. But my sweet mama, when I told her that I got diagnosed with allergies and I was confused and I was gonna have to do these shots, she took it very personally and reminded me that I was a breastfed baby, that she did her best to encourage a healthy immune system. Yeah, I have a great immune system. To my knowledge, I never got COVID, and I don't know how much of that is immune system and how much of that is just luck of the draw. Okay, I'm not gonna go off into you know what? I'm gonna make a video on long haul COVID syndrome, because one of my dearest friends is suffering from long haul COVID syndrome, and I saw him over the weekend, so that's good. So stay tuned, that'll be another fun one to watch. Feel free to send me any of your questions, thoughts, concerns, argue, prove me wrong on anything. Oh my gosh, I like to be right, but I like even more to be proven wrong, because you know what? That's when I'm gonna learn something new that I didn't know before. So don't be shy, and thanks for listening. 2 things on the nasal spray, right? Alternate your hands, point your nose to your toes. That's it, 2 things you gotta remember. Bye.